Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins. Joining us today is Heidi Stewart with the Pepin County Health Department as we get an update on the vaccinations and the COVID. And Heidi, thanks for joining us. Well, first with the vaccinations, of course, the big news has been the Johnson & Johnson vaccine. There's a hold on that. And so even for the health department, you've kind of put a hold on some of the vaccination clinics?
Yeah, so primarily here in Pepin County, we have been receiving Moderna. The health department and the hospital/clinics have been receiving Moderna. The local pharmacy, Heidi Pharmacy, had been working with the Pfizer vaccine. It wasn't until 2 weeks ago that we received our first doses of Johnson & Johnson here at the health department. We did do approximately 80 individuals that first week and another 90 individuals last week. So we provided that vaccine to about 170 people. The hospital, I believe, has also provided it to a small group of individuals. That's the good news. The bad news is that 6 individuals who had received the Johnson & Johnson vaccine are suffering a clotting disorder. One of them actually did pass away. It's 6 individuals out of almost 7 million vaccines, Johnson & Johnson vaccines given. So some of the wording that they're asking us to use is out of an abundance of caution. They are putting a hard pause on the Johnson & Johnson administration. We did have a clinic scheduled for tomorrow. We were able to cancel that clinic and replace it with a clinic for some Moderna. So we're offering 2 Moderna clinics this week for first doses. A second dose Moderna clinic will be taking place at Weiss Family Farms. And then we will also actually be offering the Pfizer vaccine to the 16 and 17-year-olds in the school districts here. So a very, very, very busy week for vaccination. We are not providing the Johnson & Johnson. If you did receive Johnson & Johnson, reach out to your healthcare provider if you have any concerns. If you start to develop symptoms related to this condition, which would include headache, leg pain, abdominal pain, some visual disturbances, shortness of breath, anything like that, please reach out to your physician right away or seek medical attention. That's for anybody. If you're having any of those symptoms and that's not normal for you, seek medical attention right away.
Talking with Heidi Stewart, Pepin County Health Officer today. Now, Heidi, I know what the vaccination rates here in Pepin County, I think we're still ahead of the state average. We're doing quite well.
We're not. We've kind of stalled a little bit. We are at, let me confirm it, the state of Wisconsin is at 37.6% vaccinated, 78.5% of the 65 plus population. We are at 34.6%, that's 2,521 people, but 72.5% of the 65 plus population. So that's good. There's lots of vaccine available. If you're having trouble finding access to vaccine, certainly let us know because our hospital has it. Zorn Arena is offering it, and they will be announcing today that there's a walk-up option. You don't even have to fill out the paperwork to attend their clinic. They have a lot of doses available up there. Vaccine is pretty much available anywhere if anybody is interested in receiving it.
I've received both my doses of the Pfizer. Rhonda received her dose of Johnson & Johnson. Again, on the second dose of the Pfizer, for me, it was the best I slept. I'd take it again just because I slept so hard that night. It was great. I loved it. And for Rhonda, she really didn't have, just her arm hurt a little bit. But I guess for us, we feel like we've at least a little bit of peace of mind knowing that at least we have this, because even with the variants, it looks like these will at least protect us somewhat with some of the variants, won't they?
Yeah, so we vaccinate for a few different reasons. We vaccinate to prevent illness. We vaccinate to lessen symptoms. we vaccinate to decrease hospitalization rates, and we vaccinate to decrease deaths. So while there still continues to be some cases and we're dealing with the different variants and how they're covered by the vaccines, we have seen a decrease in case numbers. We have seen a decrease in hospitalizations, and we have only had one or two deaths in 2021. I believe it's just one this year. So I'm talking about Pepin County. We did have another individual hospitalized last week for some difficulty with breathing. I'm not 100% sure of the status, if that individual has been discharged to home yet or not. But we're averaging over the last couple weeks, a couple cases a week. And so far we've been able to limit the spread of those by having the people do the isolation and the quarantine, back to what we were doing way back when. I know with the governor's mandate for masks being struck down, there was a potential for us to see everything just open up without masks. But when I've been out and about in different community areas, I've seen, I wouldn't say I've seen 100% mask use in all areas, but I have seen mask use in quite a few areas that I have visited. So we still do have a good percent of our population that are following that mask recommendation. And I'm happy to say that the schools are still maintaining that within their back to school plans. Masks was part of that plan, and they have not done anything to change that to this point. I would like to see them, and I've had this conversation with them. I'd like to see them get through this year. We have about a month and a half left. Let's just get through this year, and hopefully next year will be a completely different picture.
Talking with Pepin County Health Officer Heidi Stewart today. And Heidi, these variants, are we seeing the British one primarily here in Wisconsin, or is there a concern that these variants are going to be showing up here, there, and everywhere?
Yeah, so the variants that are present are the United Kingdom B117. There have been 148 cases in Wisconsin. The South Africa variant, which is the B1351, there's been 15. It's actually the California variant. I don't know if I need to say the letters. I guess if you're interested in finding out what the letters to those variants are, you can maybe look that up on your own. But there's been 216 of those, and then only 4 of the Japan variant. So when I looked before we met here, if you look at the Western Region Hospital Consortium, which is from Buffalo County all the way down through La Crosse and a little bit southern of that, there's very little as far as variance in that. Now, when you look at the Northwest, which is our southern border, all the way up to Douglas and over a bit towards Clark, Clark might not be our Herc, but they're very, very close. We're seeing a lot of that California variant, and I believe the greatest numbers of that we're seeing along the counties along the Twin Cities area. They've got quite a few variants happening over there, and a lot of our people work and play and do other things over in that area, and a lot of their people travel over potentially to work in Wisconsin. So we are seeing that variant there. I don't know why I thought of this today, but I was thinking about variants. They're a little bit of pizza. They're all the same virus. They just have a little bit different ingredients in them. And those changes can make them spread a lot. Some of them, it can make them spread more easily. It can make them more transmissible, I guess is the word. They can also make them spread quicker. So they spread easier, they spread quicker. We could be in a situation where we were in before. So getting people vaccinated, encouraging the distancing, limiting the number of people that you're interacting with, doing masking, and continuing to wash hands are what we continue to talk about. And it's been over a year that we've been doing those things. So they say if you tell somebody something 7 times, they finally then absorb it and can repeat it. So I'm not sure if we've done that 7 times.
Oh, I think we have.
times, but we'll continue to have that same message going forward.
Heidi, before we let you go, and I realize you're not an epidemiologist, but should everyone maybe be, I guess, for lack of a better word, prepared to just say, you know what, when you get your flu shot, Brian, at NAFB convention in November, you're going to have something with COVID in it too, to help with that. Do you think that's probably where this is going to end up going to? And again, I realize you're not an epidemiologist, but from what you've seen and heard.
I think it would be fair to say that if this continues to morph and there's different variants, I think whether it's going to be included in the flu shot or it is a separate thing that we do on a routine basis, hopefully not more than once a year. Maybe it's similar to some of our other vaccines where we look at a booster every 5 years or something like that. I'm just saying that these are the possibilities. I'm not 100% sure. But that is something that we may be looking at in the future. I did want to mention one more thing about the variants and how do we know we have variants here? And I'm not sure if we've talked about this on this call or not, but we continue to have our primary testing site for Pepin County available at Advent Health. Michelle Crothers is the head person there at the lab. And her staff work to identify if a positive case, if somebody goes in, they're tested, and that test result is positive, that specimen gets saved, and they can save that for, let's say up to seven days. In that time frame, then they would be back in touch with that individual that tested positive to see if they've had any travel. Is this a reinfection? If this is a reinfection, did you receive remdesivir? Did you have underlying medical conditions? Did you receive the plasma convalescent therapy? Those are some of the questions they ask. Did you receive the vaccine? If you've been vaccinated and you become infectious, it's very possible that if you answer yes to any of these questions, it's most likely that your specimen will be sent to the state of Wisconsin lab for additional testing and the sequencing to see if you have one of the variants. And to date, there's been over 9,000 of those specimens that have been sent for that sequencing. I'm just trying to add, I believe that there's been under 500 of those that have come back to be variants. So it's not a really big number when you look at the percentage of variants for the ones that are sent for sequencing. And then keep in mind that not every specimen is sent to be tested for sequencing. So.
All right. Some great information. Heidi, again, as always, appreciate you joining us today.
Thanks, Brian. Have a good day.
Pepin County Health Officer Heidi Stewart, you're listening to WRDN.